Hi everyone, I'm Dr. Siobhan. I specialize in internal medicine and rheumatology, and today, I want to take you through one of the most fascinating and surprising cases I've ever encountered. It's the story of a woman named Jennifer, who came into the hospital with leg pain and fatigue. At first glance, her symptoms seemed minor. But as we dug deeper, things became more and more confusing and more serious. What we ultimately discovered wasn't just surprising, it was something we rarely see in modern medicine. Let's get into it. Jennifer was a 54-year-old woman in good health, active, upbeat, and training for her first 5K run. She had always taken care of herself, and until recently, she felt great. But over a few months, she started to feel unusually tired. Not the kind of tired you shake off with a nap, this was deep fatigue. And then came the leg pain. At first, she thought it was just sore muscles from running, so she backed off her training. Tried stretching more, gave herself more rest days. But the pain didn't go away. It actually started spreading, from her knees to her shins, and eventually into her calves. Then, things got weirder. She noticed bruises appearing on her legs, especially behind her knees and on her calves, even though she hadn't bumped into anything. Then a rash appeared, tiny red dots that didn't itch or hurt, just sat there, spreading slowly. Over 2 weeks, the pain in her legs became so severe that she could barely walk. That's when her family insisted she go to the emergency room. When she arrived, her heart rate was a little elevated, about 103 beats per minute, but her blood pressure and temperature were normal. Nothing jumped out right away, but Jennifer looked uncomfortable. She was trying to be polite, but you could see she was in real pain. After hours in the waiting room, she was finally brought in for evaluation. So our first job was to rule out the scary stuff. With leg pain and swelling, the number one thing we worry about is a deep vein thrombosis, a blood clot in the leg. It can be life-threatening if it travels to the lungs, so she had an ultrasound. No clot. Next, we considered infection. Could it be cellulitis or an abscess deep under the skin? We ordered x-rays, again, nothing. Her bones and joints looked normal. No signs of trauma, no foreign object, nothing suspicious. Her labs were mostly normal, too. Kidney function, liver enzymes, white blood cell count, all unremarkable. The swelling in her legs was mild, but that extreme pain was hard to ignore. So we went for an MRI, hoping for more clues. And there we saw something interesting. There was fluid under the skin and around the muscle fascia, the connective tissue that surrounds muscle. Not pus, not a mass, just fluid. That pointed to inflammation, but we didn't know why it was there. At this point, we were scratching our heads. No tumor, no infection, no blood clot. So we wondered, could it be autoimmune? Something attacking her muscles? We ordered an EMG to test for muscle inflammation. That came back normal. Now, things were officially confusing. Jennifer had significant leg pain, swelling, fatigue, and now this mystery rash, but no obvious cause. Then we noticed something else in her labs. Her hemoglobin, a measure of red blood cells, was low, 96 grams per liter. That's anemia. But more than that, over the course of 3 days in the hospital, her hemoglobin dropped to 73. That's a big drop in a short time. So now we had a new problem. Where was she losing blood? We checked her stool and urine, no blood there. No signs of internal bleeding on her scans. We looked for signs of destruction of her red blood cells, called hemolysis. That was negative too. So we were stuck again. Until we took a closer look at that rash. Those tiny red dots, petechiae, are actually little bleeds, broken capillaries under the skin. So if she was bleeding there, maybe something similar was happening internally, in a way we couldn't see on imaging. It was starting to seem like the bleeding wasn't from a big source, but a lot of small ones. Still, her clotting tests were normal. Platelets, normal. No signs of a bleeding disorder. But here's where it got interesting. We decided to biopsy the rash. A skin punch biopsy can show us whether blood vessels are inflamed, or if there's immune activity, or maybe even signs of infection we missed. But biopsies take time. And Jennifer's blood count was dropping fast. She would need a transfusion soon if we couldn't find a cause. So we went back to the beginning. We talked to her again, in more detail. And that's when one of the doctors noticed something important: Jennifer wasn't eating much from her hospital tray. When we asked why, she opened up. Over the past couple of years, she had become increasingly worried about food sensitivities. She started eliminating foods from her diet, first dairy, then gluten, then most fruits and vegetables. By the time she came to us, she had been living on mostly meat and rice, with no supplements. She hadn't had a piece of fruit in over a year. And that's when it clicked. This woman had scurvy. Yes, scurvy. The disease you associate with pirates and sailors from the 1700s. Caused by a deficiency in vitamin C. We almost never see it anymore, but here it was, hiding in plain sight. Vitamin C is crucial for the body in a lot of ways. It helps your body make collagen, which is a structural protein that keeps blood vessels, skin, and muscles strong and intact. Without it, blood vessels become fragile and break easily. That explains the petechiae and the bruises. It also plays a key role in making carnitine, which your cells need to make energy. Without it, you feel exhausted, which explained her F. It also supports the immune system and helps make neurotransmitters like norepinephrine, which affects mood and stress. But here's the really fascinating part: without enough vitamin C, blood can leak into tissues, not in big obvious pools, but diffusely. That's exactly what we saw on her MRI, fluid in the fascia, causing inflammation and pain. And since it wasn't being collected anywhere or draining out, we couldn't see it until her hemoglobin dropped. It was blood loss, just hidden in plain sight, soaked into the tissues of her legs. To confirm our suspicion, we sent a vitamin C level. When it came back, the lab couldn't even assign a number. It just said, less than 10. That's severely deficient. Textbook scurvy. Now, when people think of scurvy, they picture swollen gums and missing teeth. But those are the late stages. In the earlier stages, the symptoms can be much more vague: fatigue, muscle pain, anemia, bruising, and yes, leg pain. Once the diagnosis is made, treatment is easy. We gave Jennifer high-dose vitamin C supplements, and within days, she started to feel better. Her pain improved. Her appetite came back. Her hemoglobin stabilized. Scurvy is one of the oldest known diseases. There are descriptions of it going back over 3,000 years. During the Age of Exploration, it was a leading cause of death for sailors who went months without fresh food. It wasn't until James Linn's famous trial in the 1700s that citrus fruits were shown to prevent it, long before anyone knew what a vitamin was. It wasn't until the 20th century that we discovered vitamin C as the key nutrient. And while we often think of scurvy as a thing of the past, it's still with us. Recent studies show that up to 5% of Americans have low levels of vitamin C, and among smokers, that number can go as high as 18%. Why? Because vitamin C is found in fresh fruits and vegetables. And in people with restricted diets, whether due to food fears, eating disorders, poverty, or even extreme health trends, those foods can disappear from the plate. Jennifer's case reminds us that even in modern medicine, we can't forget the basics. Nutritional deficiencies may seem outdated, but they're very real. And sometimes, the answer to a complex medical mystery isn't a rare genetic disorder or exotic infection, it's just a missing vitamin. Thanks for sticking with me through this case. I hope it reminds you, as it reminded me, that medicine is often about looking at the whole person, not just the labs, not just the scans, but their story, their habits, and their daily life. Because sometimes, that's where the answer is hiding.